So hello students, I'm back with another video. As you can see, named swelling on fetal head. So these are very common topics because इसमें से क्वेश्चंस आपके आते ही रहते हैं. एज ए PYQ आपने देखा होगा swellings of the on the fetal head. As I proceed, like as I reveal the names, you can relate कि कौन से टॉपिक्स है ये, राइट. सो फर्स्ट है, आप पहले इमेज में देखिए. ऑल आई एम ट्राइंग टू डू टू मेक यू अंडरस्टैंड थ्रू द इमेज so that your concept gets cleared. So first image, as you can see that I have marked this one. So can we appreciate that this is a swelling? This one is a swelling. This is an accumulation of something, right? Accumulation of something. So what is this? So this condition is termed as caput succedaneum. Okay, so why does it happen? It's really due to long standing labor. ये हमें दिखता है, राइट. लॉन्ग स्टैंडिंग लेबर हमें दिखता है. लॉन्ग स्टैंडिंग लेबर मैंने क्यों कहा कि अगर फीटल जो हेड है, जब वो ड्यूरिंग लेबर वो बाहर आने की कोशिश कर रहा है, तो अभी मैटरनल पेल्विस में पेल्विस के मतलब प्रोग्रेस हो रहा है थ्रू द मैटरनल पेल्विस, जो लेबर प्रोसेस है. अभी वो जो फीटल हेड है वो बाहर आने की कोशिश कर रहा है, अभी वो स्पेस में, वो कंजेस्टेड स्पेस से वो बाहर आने की कोशिश कर रहा है. अभी वो लेबर भी बहुत मतलब देर तक प्रोलॉन्ग्ड हो रहा है, तो द फीटल हेड गेट्स कंप्रेस्ड in that space. So what happened? So due to long वो यहाँ पे वो compression की वजह से वो जो fluid होता है ना, एक्स्ट्रा सेलुलर जो fluid होता है, जो हमारे जो space में एक्स्ट्रा सेलुलर fluid जो skip होता है, skip होके वो यहाँ पे आके पेरियोस्टियम जो हमारा होता है, एज यू कैन सी कि मैंने लिखा है कि यहाँ पे मैंने स्कैल्प लिखा है, देन पेरियोस्टियम लिखा है एंड देन स्कल लिखा है. सो ये पेरियोस्टियम को क्रॉस कर जाता है, ठीक है. पेरियोस्टियम को क्रॉस करके ऐसे करके वो जो फ्लूइड है वो एक्यूमुलेशन यहाँ पे हो जाता है. आफ्टर द बेबी कम्स आउट, यू कैन सी देयर इज अ स्वेलिंग ऑन द पार्ट, ऑन वन पार्ट ऑफ द बेबी. वो आप ड्यूरिंग द इफ़ यू आर पोस्टेड इन लेबर रूम, so you can see the babies after prolonged labor, as I have written that long standing labor, due to the compression in the मैटरनल जो पसाज होता है, जो कैनल होता है जहाँ से बेबी निकलता है, ड्यू टू कंप्रेशन ऑफ दैट वहाँ पे स्वेलिंग होता है, क्योंकि वहाँ पे फ्लूइड जो होता है हमारा, एक्स्ट्रावास्कुलर जो फ्लूइड होता है वो स्किप करके वहाँ पे एक्यूमुलेट हो जाता है ड्यू टू कंप्रेशन, राइट. सो दैट्स वाई द सिचुएशन अराइजेस. एंड ये ऑल्सो क्या करता है ना, क्रॉसेस द पेरियोस्टियम, ठीक है. ये आप देखो पेरियोस्टियम इधर है, तो पेरियोस्टियम का क्रॉस करके ये यहाँ पे चला गया. बट इट्स अ नॉर्मल फिनोमेना, यू कैन से, राइट. सो कॉज क्या है मैंने बताया. ओके, नाउ ये कब तक रिजॉल्व करता है? ये रिजॉल्व करता है जनरली 6 to 8 hours आफ्टर बर्थ. You don't need to take any intervention for that, as it's a normal phenomena after birth. It gets resolved, okay. And ये at the time of birth, you can see when the baby is coming out, you can see that it's already there, right. It's already there, and the head gets compressed for a long time. And when the baby is coming out, the first तो head पहले निकलेगा ना, तो when the head is coming out, you can see that due to the long standing compression, due to the long standing labor process, there's a accumulation of fluid, and that's why the area gets swollen over there. तो at the time of birth you can see it. So at the time of birth ये present होता है वहाँ पे. And as I have said that it's a normal phenomena, so you don't need to take any intervention. It gets resolved by its own. Okay. Now next the situation, as you can see I have marked this place, or you can see that I have marked the accumulation of something with red, just to make you understand. So red denotes what? Right, red denotes maybe it's blood accumulation. That is why I have marked this with red. Accumulation. So इस सिचुएशन को हम ना मतलब ये it will be termed as cephal hematoma. Hematoma means obviously there will be accumulation of the blood. There will be inside the body there will be accumulation of the blood, right? So now just look at the image. At first here comes the scalp. Now the next is periosteum. So is it above the periosteum or is it below the periosteum? What you will say? Right, this is below the periosteum. On the other hand, what you can see, is it above the periosteum or is it below the periosteum? Right, it's above the periosteum and it's below the periosteum. अब देखो यहाँ पे periosteum के it's crossing the periosteum but it's inside the periosteum, so it doesn't cross the periosteum. ठीक है, and here's also a catch, so you can differentiate it. And in caput succedaneum you can say that there is a C and there is a S. So can we appreciate that it cross suture line means it's crossing the periosteum and the periosteum is denoted as the suture line. आपने पढ़ा होगा sutures, coronal suture, frontal sutures. Previous videos में I have already discussed sagittal suture, lamellate suture. And here in this case, in this cephal hematoma case, it's not at all crossing the suture line, so it doesn't cross suture line. So it's one of the repetitive questions being asked in the exams, that in which condition it crosses the suture line. Is it cephal hematoma or is it caput succedaneum? So after you are seeing this image, so you will not be able to forget, right, that in which condition the suture line is being crossed. Absolutely, it is being crossed in caput succedaneum, and cephal hematoma, it doesn't cross the suture line. Okay, and absolutely there is accumulation of the fluid and it's accumulation of blood. So there are two differences I have told you. Now next, which condition leads to cephal hematoma? So there is a blood accumulation, so must be there is a inside there will be bleeding somewhere. So why the bleeding will happen? Bleeding तो ऐसे ही नहीं होगा ना. Bleeding will happen due to some some injury, right? So what kind of injury will happen in such cases, or during labor what kind of injury can lead to such kind of situation? So can we appreciate it is due to instrumental delivery, and the instrumental delivery will lead to what? Will lead to cranial bone fracture. Cranial bone fracture. So fracture is denoted via this sign. That's why I have written like this. I have not written the full spelling of that fracture. So instrumental delivery will lead to cranial fracture, and that is why the cephal hematoma arises, right? So how long does it take to get resolved? So it will take 2 to 4 days after birth. Next, so at the time of birth, is it present? No, it will not present. After birth you can see it, but at the time of birth you will not be able to see it. But in case of caput succedaneum you will be able to see that it's present during birth, right? So here's another question. So can we drain the blood that is that has got accumulated here? The answer will be no. Never drain cephal hematoma, right? Never drain cephal hematoma. So along with that, can we say that there is blood accumulation, right? So if there is blood accumulation, it's a basic concept. You can like I think that I should make you understand it too. Accumulation. So if there is blood accumulation that happens in case of cephal hematoma, so अगर blood accumulation होता है, so there will be increased RBC, and this is due to what? This is due to increased hemolysis. Hemolysis means what? RBC get destroyed. RBCs get destroyed. So increased RBC destruction will lead what? So increased RBC destruction will lead to increased bilirubin. So can the baby land up into jaundice, right? Because हम jaundice में क्या देखते हैं कि in case of increased bilirubin, in case of jaundice we see the values of bilirubin, and the bilirubin gets increased in that case. So in case of hematoma, the baby can be presented with jaundice as well, right? As there is a injury, so there will be hemolysis, so there will be RBC destruction. So if there is increased RBC destruction, that will lead to what? That will increase bilirubin, and increased bilirubin will land up into jaundice. Okay, so I hope the concept gets cleared. Now moving to the next topic. As you can see that the topic written over here is Leopold maneuver, and it's also one of the important topics that is being asked repetitively in any kind of nursing recruitment exam, as well as at your university exams, or as well as at your practical examination. So first, before moving to the topic, so what we need to remember before performing this examination, हमें क्या बोलना पड़ता है, like patient को क्या बोलना पड़ता है? Patient को first we have to explain that what kind of examination we are going to perform, right? Next क्या मतलब ये हम क्यों कर रहे हैं, ये we have to explain ना first. So first you have to explain. Second you have to tell her that फर्स्ट टू एम्प्टी हर ब्लडर, मतलब आप पूरा अपनी मतलब आप यूरिनेट करके पूरा ये, सो दैट योर ब्लडर गेट्स फुल्ली एम्प्टी. नाउ आपको बोलना पड़ता है, यू विल आस्क हर टू लाई डाउन एट डॉर्सल पोजिशन. पोजिशन क्या होगा? डॉर्सल पोजिशन. सो वंस द वुमन urinates and her bladder gets emptied, so we will ask the patient to lie down on dorsal position with knees flexed. आपको बोलना पड़ेगा कि वो लाई डाउन करेगी डॉर्सल पोजीशन में, थोड़ा सा उनका नीज फ्लेक्स होगा, ठीक है. नाउ पर एब्डोमिनली इट इज़ टू बी एग्जामिन्ड. आपको पर एब्डोमिनली ही ये करना पड़ेगा, ठीक है. सो दिस आर द फ्यू पॉइंट्स यू नीड टू रिमेंबर बिफोर स्टार्टिंग योर एग्जामिनेशन, including there are some points that these 1 2 3 these 3 maneuvers will be performed or facing the patient's what? Facing the patient's face, okay. And this fourth, or the you can say the last maneuver, will be done facing the patient's feet. मतलब अब जब भी आप एग्जामिन कर रहे हो पेशेंट को, सो यू शुड बी एट द राइट साइड ऑफ द पेशेंट, राइट. नाउ फर्स्ट जो 3 मैन्यूवर्स होते हैं वो आपको पेशेंट के फेस के तरफ करके करना पड़ता है, राइट. एज यू कैन सी दैट आई हैव डिपिक्टेड हेयर कि हाथ जहाँ पे है, तो आपका अगर हाथ यहाँ पे है तो आप पेशेंट के सामने हो, सो यू कैन सी पेशेंट्स फेस, ओके. सो यू आर फेसिंग पेशेंट्स फेस नाउ. और ये जब आप कर रहे हो फोर्थ मैन्यूवर में, तो आप देख रहे हो कि आपका हाथ उस तरफ है, सो ऑब्वियसली कि आपका बॉडी उस तरफ होगा. नाउ अगर नाउ योर हैंड्स आर इन दिस प्लेस, सो ऑब्वियसली यू आर फेसिंग पेशेंट्स व्हाट? यू आर फेसिंग पेशेंट्स फीट. सो दैट्स इट. नाउ लेट्स स्टार्ट. फर्स्ट the grip, first the grip is Leopold first maneuver or it's called fundal grip. सो नाम से ही पता चल रहा है कि फंडल जो है आपको पेशेंट के फंडस को पैल्पेट करके करना पड़ेगा, ठीक है. ऑब्वियसली बिफोर स्टार्टिंग एनी काइंड ऑफ एग्जामिनेशन यू शुड डू हैंड वॉश. नाउ यू विल स्टार्ट. नाउ फंडल ग्रिप, जब भी आप फंडस को पैल्पेट कर रहे हो पेशेंट के और द एंटीनेटल मदर के, तभी आप पेशेंट को करते वक्त अगर आपको if it's baby's buttocks, then you will feel which kind of structure it will be soft, क्योंकि buttocks soft होता है, irregular you can say and broad, ठीक है. आपको ये फील होगा if it's बटक, फंडस में अगर ये बेबी का बटक है तो यू कैन फील दीज फीचर्स. ओके, सो व्हाट डज अ फंडल ग्रिप टेल अस, किसके बारे में बताता है जनरली, मतलब ये जो हम कर रहे हैं इसके पीछे मतलब ये क्या बताता है कि ये हम मतलब परफॉर्म करते हैं. तो फंडल ग्रिप से हमें पता चलता है अबाउट प्रेजेंटेशन ऑफ द बेबी. सो व्हाट इज प्रेजेंटेशन, दैट इज पार्ट ऑफ द यूटेरस covering the lower part of the part of the baby that is covering the lower part of the uterus, right? So it tells us about the presentation and lie. Lie is what I have discussed in the previous video. So let's now let's do a quick recap. So what is lie? Lie means the relationship of the mother's axis with the baby's axis. So it can be divided into longitudinal lie, oblique lie and transverse lies. Okay, go through my previous videos also for that. Now, so the first grip tells us about the presentation and lie, and it will be palpated at the fundus of the mother, and if it's buttock at the if it's buttock at this place, you will feel this kind of a structure that is soft, irregular and broad. Now come to the second grip, that is called lateral grip. So as you can see, lateral grip can also be termed as umbilical grip. So during examining, if you feel if it's baby's back, you will feel which kind of structure, you will feel curved structure, because as you can say curved, you can see that it is curved, board like structure, and it will be smooth, right? So if it's baby's back, you can feel this structure. So if it's baby's back, you will feel this phenomena. Okay, now if it's baby's what you can say, if it's baby's fingers, right? If you can feel like there is some irregular kind of knob kind of structures, irregular knob, small kind of structure, so what will it denote? It will denote that it presents baby's fingers. Okay, because इस साइड में अगर मैंने ऐसे ही करके डिपिक्ट किया है, इस साइड में अगर बेबी का बैक होगा तो यू कैन फील कर्व्ड, बोर्ड लाइक एंड स्मूथ स्ट्रक्चर, एंड इस साइड में जस्ट इमेजिन, इस साइड में अगर बेबी का हाथ पैर होगा तो आपको क्या मतलब कर्व्ड कुछ मिलेगा? नहीं मिलेगा, आपको मिलेगा इरेगुलर कुछ स्ट्रक्चर्स, नॉब लाइक कुछ स्ट्रक्चर्स, क्योंकि फिंगर्स होगा उस साइड में एंड स्मॉल होगा. सो हेयर यू कैन डिफ्रेंशिएट कि कौन सा बेबी का बैक है एंड कौन सा बेबी का फिंगर्स है, ठीक है. नाउ जिस साइड में हेयर इज अ कैच, जिस साइड में बेबी का बैक होगा उस साइड में बेबी का पोजीशन, एज पर दैट वी विल डिसाइड द पोजीशन. लाइक सपोज इफ द बेबी इज बैक एट द लेफ्ट साइड, ठीक है. सो if baby is back at the left side, then the position we can say that it will be left occipito anterior or left occipito transverse or left occipito posterior, etc. So this grip, it tells about the position. I've also discussed about position in my previous videos, so just go and watch that, ठीक है. Now Next, it's third maneuver. Now, as you can see that in this maneuver we are using both our hands, but in this maneuver we are doing it just using one hand. Is it visible? Okay. So we are doing it using just one hand, like, and we are trying to feel what? We are trying to feel baby's head, and where our hand is above the symphysis pubis. This area above the vagina is called symphysis pubis, and our hands are placed just above the symphysis pubis, and we are feeling the baby's head, and we are trying to move the baby's head from side to side like this. Okay, so while doing the examination, so first we are doing it with our one hand, and we are trying to like move the baby's head from side to side, and our hand is placed over where? Above the symphysis pubis. And if we are able to move the baby's head from side to side, that means baby's head is ballotable. Okay, ballotable means what? Ballotable means you can move baby's head from side to side. So if you can move baby's head from side to side, so does the head get engaged then? Does baby's head get engaged then? So answer will be no. Baby's head doesn't get engaged. And on the other hand, if you can't be able to move the baby's head from side to side, so can we say that then baby's head is not ballotable? So right, अगर आप बेबी के हेड को ऐसे मूव करके फ्रॉम साइड टू साइड कर पा रहे हो, दैट मीन्स बेबीज हेड इज़ बलॉटेबल. मतलब बेबी का हेड अभी भी पेल्विक कैविटी में एंगेज नहीं हुआ है. और अगर आप मतलब बेबी के हेड को ऐसे मूव फ्रॉम साइड टू साइड नहीं कर पा रहे हो, दैट मीन्स बेबीज हेड इज़ नॉट बलॉटेबल, सो इट हैज़ ऑलरेडी गॉट एंगेज्ड, राइट. Now the fourth and the last maneuver, that is pelvic grip, or you can say it deep pelvic grip also. So as I have already said previously that you have to do it facing the patient's feet. आप ये आपका हाथ है, ये this is not mother's hand, these are examiner's hand. Okay, तो ये आपका हाथ है and you are trying to examine that does baby's हेड गेट एंगेज्ड और नॉट. सो आप जब ही ये दोनों हाथ को मिला के टूवर्ड्स द पेल्विक कैविटी में आने की कोशिश कर रहे हो, एंड योर हैंड्स गेट व्हाट? कन्वर्ज्ड. दैट मीन्स इफ योर हैंड्स गेट कन्वर्ज्ड means it doesn't get engaged. Baby's head doesn't get engaged. एंड अभी जब ड्यूरिंग एग्जामिनेशन आप एग्जामिन करने की कोशिश कर रहे हो एंड योर हैंड्स गेट डाइवर्ज्ड, मतलब ऐसे फैल रहा है, दैट मीन्स व्हाट? बेबीज हेड गेट एंगेज्ड, राइट. सो ये हमें क्या बताता है? इट टेल्स अबाउट द थर्ड ग्रिप. Actually it confirms the third grip, and it's quite comfortable than the third grip, because ये हम एक हाथ से लेके ऐसे कर, so from comfort perspective it will be more comfortable than this. And third is what? It tells us about what? Not tells us about attitude of the baby. So what is attitude? Attitude means the relationship of the fetal parts with each other, and the examples were flexed, fully flexed. So if the baby's head is fully flexed and deflexed, then the presentation will be vertex, then the presenting part will be vertex. And if baby's head is fully extended, then the presenting part will be what? Presenting part will be face. And if baby's head is partially baby's head is partially extended, then the presenting part will be bro. So these all I have discussed in my previous videos, so do watch them. So today I have discussed about two important topics that are being asked repetitively in your exams. So I have tried to make it as simple as that. I have tried to make it more concise, so your any queries get resolved via this. And still, if there is any query, just comment me below, drop a question in the comment section of my video, and do watch my videos, and also suggest me that what kind of videos I should be making more. And yeah, so stay healthy, keep studying, and like, share and subscribe my channel. And okay, then bye, stay tuned.